So welcome back, guys, to the World Autism Summit. And now I'm so excited to introduce Dr. Michael Cameron, who is a board-certified behavior analyst, currently serving as a chief scientific officer at Early Steps Pediatrics Group and chief clinical officer for Upskill ABA. He also teaches at the University of Southern California's Department of Psychology and Applied Behavioral Analysis. His expertise includes severe behavior treatment, behavioral intervention technologies, and knowledge management. He previously worked as chief clinical officer at Springtide Child Development and was an associate professor at Simmons, like the name, University. His education includes a master's in applied behavioral analysis and a PhD in experimental psychology from Northeastern University. So welcome, Michael.
Thank you, Karen.
Really glad to have you here.
Thank you.
Yes. So what has inspired you to be part of the World Autism Summit?
I think it's an opportunity to really get diverse perspectives on autism, not only from an assessment standpoint with respect to autism, but also in terms of a support perspective. You know, what are the best supports that need to be in place for families and individuals who are autistic. So when I was invited to participate in this conference, I thought this is something where I want to get my voice included as well and contribute what I have to offer to this very important endeavor.
I know one thing that excited me about what you were talking about was like pre-early intervention. You wanted to really dip into that, so we'll get into that conversation later. And I know there's a lot of different methodologies out there, methodology soup that people are exploring nowadays. But anyway, how do you hope to make the biggest impact in the world around autism?
The area that interests me the most in terms of autism support is what I would classify as knowledge management. I think up until this point, we have a rather archaic system in terms of accessing information that can be used to support both families and children. Typically, a family relies on the knowledge base of a single physician, for example, and maybe it's a developmental pediatrician, or they're relying on the knowledge base of a single speech and language pathologist or occupational therapist. But with today's technologies, we have the capability of building and developing knowledge management systems where instantaneously speech and language pathologists and occupational therapists and physicians from the medical community can acquire information that will guide them and help them guide a family. So my background, although it's in psychology, it's also in technology, and I've built knowledge management systems in the past and currently doing it again now. So this is where I really look to make a mark over the next 5 years is developing these technology-enabled knowledge management systems that will really facilitate information exchange and facilitate the guidance for families and children.
And that sounds like that could really, really go all over the place, all over the world.
Exactly. Yes.
Yeah, with the technology. I love technology. It's kind of my thing, I love it. My dad was an aeronautical engineer, so we kind of always talked about it. What is the biggest why for what you do?
I've spent a lot of years of my life, Karen, supporting families with children, very, very young children and also adult children as well. And I've seen the struggles with family members, especially when that individual that is a child or an adult child has a co-occurring condition. So in addition to a diagnosis of autism, the individual may have a medical co-occurring condition or a psychiatric co-occurring condition. And I've seen what kind of stressors that creates in the life of family members.
Mm-hmm.
So anything that I can do to help people breathe easier and maybe receive expeditiously the guidance that they need from a preventative standpoint and also from the standpoint of a support system, it's really important to me that these families receive the proper supports that will help them achieve a quality of life that they enjoy.
That's great. That's great. How can we set up systems of success in partner relationships globally?
I think one of the things that's important, and one of the models in terms of autism support that really interests me, and I just published a book chapter on this very topic, it's what's referred to as the medical neighborhood model, whereby individuals collaborate on behalf of a family or a child. To answer your question, it's that kind of system that I've determined to be absolutely essential. And making reference back to what I said a moment ago, because so many individuals have co-occurring conditions, because there are medical complications and psychiatric complications, and those conditions and those struggles really evolve as the individual ages and they go through the lifespan. So from a system standpoint, establishing structures like a medical neighborhood model where there's effortless collaboration between primary care physicians and specialists such as a GI doc and psychiatrists and speech and language pathologists and occupational therapists, those systems are essential. It's also important that families receive what's referred to as care navigation. So from a system standpoint, ensuring that family knows what's available to them in terms of supports, because we talk a lot about the social determinants of health, and a family's health is dependent on not only the treatment that a professional can provide the individual with autism and the family, but also it's connected to other aspects of living, proper housing and employment and mental health supports for the family members as well. So we're only as good as our systems at the end of the day, and I really see a medical neighborhood model as being essential, and a system that really requires more development at this point.
Oh, that's beautiful. I love that, because connecting the neighborhoods and connecting all the different methodologies, even there's lots of things you can learn from all the different types of methodologies. I know that it's very, very good.
Yeah, even for families, connecting them to faith-based organizations, depending on the family's, religious beliefs and spiritual beliefs. I think just aligning things for a family and doing that, with objectivity and just understanding just exactly what it is the family needs and coordinating services for them that are really multifaceted it's what's really important right now.
And I imagine cultural needs as well.
And cultural, yes.
So when we look at an area of child development, it's evident that the earliest stages are some of the most crucial. And given your expertise in this area, I'm curious, and believe our conference participants would be as well, what personally drew you towards emphasizing early intervention services?
Currently, the level of awareness around autism is very, very high. And it's not just in the United States, it really is worldwide, that this is on the radar of families, especially families that are expecting a child. And more importantly, really, especially for families that already have a child with autism and they're about to have a second child or a third child, for example. So because of that level of familiarity and understanding of autism, and because of the advancement in technologies, as a culture and a community, we're getting really good at early detection. Which means that at 6 months old, 7 months old, the family may begin seeing signs of delays. For example, that child may not be babbling, or if the child is babbling, there may not be much diversity in terms of that babbling, or the child is not crying at all, or if they are crying, they're just completely dysregulated and inconsolable for very long periods of time. So we're seeing families detecting and identifying at a very, very early age these signs and symptoms. That's what's referred to as a prodromal stage of autism. The diagnosis has not occurred. It's just the child is showing early signs and early delays. More often than not, when that family member brings their child to the primary care physician and raises these issues, that family member is told to wait and see how that child develops. Just wait to see, he might be a late talker, or she might, develop a little more slowly than others, but let's wait and see what happens. In consequence, what we know, not only in the United States, but also abroad, that the average age of diagnosis is between 3 and 4 years old. So the implication is that that family, having detected something at 6 months old or 7 months old and told to wait, is now waiting until the child's 3 or 4, and they miss a major developmental window and a major opportunity and a very important opportunity to guide their child's life. So that is why I'm just very, very focused on this particular age group, because I'm extremely motivated to get support in place for families that are seeing prodromal signs of autism, and get the proper guidance in place for those family members at that level, so they're not feeling like they're having to wait. If any of us in this room, any people listening to this broadcast, has ever received any kind of diagnosis, it could be a disease state or some kind of condition. It's unacceptable to us to be told to wait for treatment to see how it evolves. Our attitude is, no, we're going to do something about this right now. And what we're going to do about it right now is going to be based on state of the science in terms of best treatment and best practice. And that is what I want for myself, or that's what I want for my loved one and my family member. It should be no different for a family that is seeing prodromal signs in early stages of delay. They should receive state-of-the-science treatment, and that should be delivered expeditiously without delay. And that really motivates me.
And that was one of the main reasons I wanted you here, because I was also told to wait and see. And it was the determination of my sister-in-law that says, no, you got to get him in to see somebody. And I was still told to come back in a year. So yes, it's absolutely critical, for people to pay attention to things at a very, very early age. So thank you for doing that. What are the key reasons or experiences that influenced your interest and focus on this direction? I think you answered that in that, basically.
Yeah, because I've seen so many families. Karen, I've sat in so many rooms where the assessment has been done, or we've brought a family through the diagnostic process. And I've sat knee to knee with family members after having completed the diagnostic and the battery, of assessments that we needed to do. And then the news is delivered to the family. And one of the very, very first questions is, after they process the information, the very first question is, what do we do? Mm-hmm. What is our clinical pathway? What is the next step for us? What steps should we take to make sure that my child, develops, optimally, given the autism? What can I do as a parent to make sure that my child's quality of life is good? I've heard that question so many times, that it's really important to me to use my skills, knowledge, and abilities to guide those families that are posing that question.
And I know in some families' cases, it can be a state of, one family member may be in a state of denial. Yeah. There's a lot of shame and a lot of guilt around the diagnosis. So that slows the process down a lot too.
And that is driven very much by culture as well. I've worked with different families from very diverse cultures, and some cultures, they don't want to hear those words. They don't want to hear autism. And if you are saying those words, they immediately begin thinking, what was it that they did or they're responsible for that may have resulted in this outcome that they're hearing. So it really is quite diverse in terms of how that information is managed. And
right. But the impact that has on the child is very severe, because it slows the process down of getting the early intervention in place. Anyway, in the title of your presentation, you prominently highlighted the concept of parent-led intervention. While many intuitively understand the value parents bring to the developmental table, I'm curious about your professional reasons for this. Could you elaborate on your specific reasoning behind championing this approach?
One of the things that's interesting is that parent-mediated intervention is one of the 28 evidence-based practices in terms of supporting individuals with autism spectrum disorder. However, it's often the case that the parent-mediated intervention is de-emphasized by professionals. Many times the professional wants to lead the family to believe that they have to get support from a speech and language pathologist or an occupational therapist or a board-certified behavior analyst in order to guide their child's life, whereas really they are in the optimal position to guide their child's life. They are the ones that have the bond with the child. They're the ones that have the relationship and are motivated optimally to be nurturing their child. So giving the family the capability and the knowledge in order to do that and to really, guide their own child's development is critically important. The other thing that the family brings to that situation is that the family is going to preserve what's important to them during that guidance process. So if it's a bilingual family or a multilingual family, that's important to them, and that's going to be integrated into their entire guidance system. Because that child may be exposed to multiple languages, based on family choice. It's also the case that a family's rituals and routines and things that they do, and it's very personal, what families do and what their lives look like. And if treatment and support is not part of the fabric of those natural rituals and routines, then things can feel very contrived for a family and very many times very off-putting because it seems very odd what somebody is asking them to do. So preservation of language, preservation of culture, preservation of rituals and routines for a family is why I advocate for parent-led treatment.
Well, the family is there for the lifetime. The family is the anchor. The family stays there throughout. And you have to retrain the SLP and the OT and everybody from year to year to year. That's why I wrote my book, Little Rain Man, is because I wanted like a kind of a manual for everybody to pass on so they could understand my son. And it's like, it's going to be there for their lifetime anyway.
That's exactly right. And families evolve and families change, and whatever support is being provided to a child has to have sensitivity around those changes in the evolution of a family and a family life. Right. And no professional can bring that to you.
No.
They just can't. They're just gonna make recommendations based on their world knowledge of intervention, and it's not going to be individualized and highly customized based on your unique family needs. So this is why I'm a champion of a family-led, parent-mediated intervention.
I've always looked at the professionals as keys to the treasure chest. They have a treasure chest of information, and I always, looked at that way. So anyway, throughout your work, you've touched countless lives and witnessed firsthand the transformative power of support for families navigating early signs of developmental delays. What form of support would you underscore as vital?
The support that is vital, especially because we are talking about children with showing early signs of autism. The support that is absolutely critical, in my opinion, comes from a speech and language pathologist. A speech and language pathologist is an expert in child development. They know how a typically developing child should evolve. They know how a child with developmental delays presents, from a clinical standpoint. Because of their knowledge base, I think that they're in the optimal position to support a family and the family's needs. The other support that is vital, and I mentioned it before, is that if that child has a co-occurring condition like a seizure disorder, a neurological disorder, or if they have a sleep disorder, or many of these children also have feeding disorders where they're rejecting food, or they're over-selective in terms of what they're consuming, or they're just rejecting completely, foods being delivered to them. It's that medical support that is also critical. So getting guidance from a speech and language pathologist, getting guidance from the medical community if there is a co-occurring condition is going to be vital for the family. And then also education, centered on neurodiversity and children who are neurodifferent. Because one of the things that has to be the North Star is that child will develop based on who they are, and autism is who they are. And professionals are not in the business of trying to change that trajectory. It's trying to get a family to understand individuals who are neurodifferent and provide the appropriate supports for that child to develop optimally within the context of their neurodifference. So I think that is vital in terms of support. I think finally, Karen, there's been a lot of discussion, and I'm pleased to see this, on what's referred to as assent-based treatment, meaning that treatment and support that you're putting in place for a child should not be a struggle with the individual. It should be based on that individual's unique strengths, what capabilities they bring you, and you pull the thread of those strengths and you pull the thread of those capabilities, and you develop the child in that direction, and you do that with their gleeful participation and engagement with alacrity. It's really important. I'll tell you a quick story, Karen. I did consultation for a number of years for Perkins School for the Deaf and Blind. And I remember working with one young boy. He was probably about 3 years old at the time. He was really consumed by what we refer to as stereotypy. It could be tapping that's occurring, or body rocking, or some kind of movement with the body. But one of the things that I noticed was that his tapping was extremely rhythmic. And the other thing that he did was that he explored different surfaces. So we would tap on a hardwood surface, like a desk, for example, but then he'd go over to a metal file cabinet, tap on the side of that. And he wasn't completely deaf. He was hard of hearing. He was blind. But he would just pay very close attention to the acoustics and the sounds that were being generated. But this behavior, this tapping, these stereotypies, pretty much consumed his entire day. One of the things that we put in place in terms of a support system was giving him an appropriate outlet. So we essentially taught him drumming. We used drumming pads. And we used other musical instruments, and like bongos, for example, and drums to give him the appropriate outlet. I'll fast forward for you because his mom got in touch with me about 5 years ago, and she said that he's just done so well, and that he was just recently accepted into the Boston Conservatory for Music. He developed into a musician. Wow. And at this point, a very accomplished musician at Boston Conservatory. Wow. So the whole point is that recognize the strength somebody's bringing you, recognize the capabilities that they're bringing you, and that may be completely different from your worldview and knowledge. I'm not a musician. I know very little about music. I have high, appreciation for music, but I'm not a musician. But I think it's really important for professionals to recognize and to see what another individual brings, and then to gather the resources they need in order to really pull the thread of those interests and pull the thread of those capabilities, because you never know how it's going to evolve, and it could be life-defining for the individual. And in this boy's case, young man now, it was life-defining for him. And I think because we detected at a very early age that there was something there, and it would be easy to call it a stereotypy and to pathologize it, but we elected at that point to call it an interest and to support it and develop it.
I'll just say one thing. Stephen Shore and I just finished creating a course for the music teachers to teach children with music, that autistic and neurodiverse children, music in the School of Rock. So yeah, because they have so many people going to their school that are interested in music, that are autistic.
Exactly.
Neurodiverse.
Exactly.
So anyway, yes, I
That's
know.
such a wonderful initiative. Yeah.
Yeah, that's a beautiful story, though. That is a beautiful story. What you told me, I love it. That's great. Anyway,
You started the conversation with the why, and asking, about my why. And that's one of them, Karen, is that, if you can have a hand in helping somebody define and realize, what their human potential is, what an incredible privilege to be able to be part of a process like that.
Yeah, it is great. Great. So you've highlighted the role of humanistic AI in your presentation title. For our audience who might be hearing this term for the first time, I don't know if there's anybody left that's hearing it for the first time
Right.
now,
Yeah.
because it's way out there, or those wanting a deeper understanding. Could you illuminate what humanistic AI truly means and why it's generating such significant interest?
I mean, you're absolutely right. There's so much press and conversation around artificial intelligence at this point. There are two different areas and two different branches of artificial intelligence. One of which is referred to as strong AI. Strong AI, and the motivation of individuals developing strong AI is that they do want to replace the need for human service. So in robotics, for example, there's a desire to replace the need for humans for producing and doing things that can be manual in nature. Even out of Boston, there's Boston Dynamics that has developed, I think the device is called Spot, which is a robot, which does a lot of very risky analysis. So the device, the robot Spot, will go into construction zones, for example, and do the analytics with respect to the construction site. So that's a great example of strong AI, where individuals and humans are completely being replaced. And in that case, it's from a manual standpoint, but in other cases, it's from a cognitive standpoint. Humanistic AI, on the other hand, is AI where the motivation is to align AI with human interest and to augment and to supplement human capability, as opposed to supplanting it and replacing human capability. So humanistic AI, I see as being and will be a major driver in autism support and services as we move forward. But it's an AI that will help physicians. It's an AI that will help psychologists. It's an AI that will help speech and language pathologists, occupational therapists, physical therapists, and not looking to supplant their role or the expertise that they bring. So that's a brief definition of humanistic AI, but it's aligned with human interests and not motivated and looking to supplant and replace humans.
So it'll just sort of speed things up a bit?
Tremendously.
Yeah. Okay. The nexus between parent-led therapy and humanistic AI is both fascinating and pioneering. For our audience seeking clarity on this interdisciplinary approach, could you bridge the understanding for us?
With humanistic AI, one of the things that we're seeing is that from a genetic standpoint, we're learning more and more about the genetics of autism. There's not a high percentage of individuals with autism where there's a genetic causation. It only accounts for maybe about 10% or 12% of all individuals. However, as a result of detecting some kind of genetic base in terms of autism, AI really helps in terms of identifying what the best treatment and clinical pathway is, given that genetic presentation of an individual. It's also the case with, we'll take medication. Many individuals on the spectrum, not necessarily as early as 6 months old, 7 months old, but as the individual gets older, many of these individuals are subjected to some kind of pharmacological intervention. The pharmacological intervention often occurs because the child may present with gastrointestinal problems. They may present with some kind of psychiatric co-occurring condition like an anxiety disorder. So many of these individuals are subjected to pharmacological intervention. With AI and with the development of what's referred to as pharmacogenomics, families can understand as a result of a DNA analysis, just exactly what medication their child is going to be most responsive to, and what medications that their child should absolutely not be prescribed because the child will not respond well to it. So that is an AI-driven process as well. As a result of our knowledge, regarding pharmacogenomics, families can be better guided in the event that pharmacology needs to be used as part of a support system for an individual. So the AI results in just expeditious information being delivered and expeditious guidance for individuals. But from the standpoint of humanistic AI, I want to touch on that again. One of the things that's interesting, from an AI standpoint is that, and I do this now, I can enter in information about a family. And for example, maybe I'm working with a family from India. Maybe their primary language is Hindi. Maybe they work and live in New York City. And maybe mom, who's the primary caretaker, likes going out for walks in parks in the city on a day-to-day basis. From a humanistic AI standpoint, one of the things that I can do is enter those inputs into the system, indicate just exactly what mom likes doing on a day-to-day basis, what her primary language is, how important it is in terms of the preservation of her culture, Indian culture. And then the output comes a treatment plan and a protocol that she can follow that preserves all of these things that are important to her language, her culture, and also contextualizes the intervention. So maybe, we're trying to support the development of joint attention skills. And the context that mom can support that and develop that could be during walks in the park. So it's the natural environment, and it's exactly where, parent-mediated intervention would be most effective is while mom is interacting with the young child. But it gets even more interesting, Karen, because one of the other things that we can do with AI is take the writing sample of a parent and the speaking sample, the language sample of a parent, and put that in place as an input. So the output from AI is in the writing style of the family. Or if it's verbal based, it's in the speaking style of the family. And this is what we know, to be health literacy, right? Is that how many of us in this room here, listening to this broadcast, has been told by a physician some important information, and we sat there looking blankly at them, thinking, I have no idea what this person just told me. I have no idea what all of these things mean. And quite frankly, I'm even a little uncomfortable and embarrassed and a little bit emotional right now to even ask questions. This is what families go through all the time. So from an AI standpoint, the capability of having outputs that are in the family's language, that is in the speaking style of the family, is just enormously important. And it's something that's enabled by humanistic artificial intelligence.
That is amazing that you can do that now. Wow.
With ease. It's done very, very simply.
So how do these two seemingly disparate concepts intertwine to create a holistic impact? I guess that's how.
Yeah, you would think that there's, such a discrepancy between, human support and professional support and AI. But I see them interconnecting and intertwining. The world is shifting now. It is shifting, and we will see this interface, between artificial intelligence and human knowledge and human support. And if we're really fostering, the development from a humanistic AI standpoint, we can see that this can be done for benevolent purposes and to allow people to achieve a level of quality of life that they otherwise would not have known, had it not been for the interface with technologies. So what at first blush seems disparate, I see it interfacing quite nicely, and if done responsibly, with caution, with high level of sensitivity,
Right.
and high regard for the human condition, I think we can really benefit from these technologies now.
That's great. So what are your next steps, Michael?
At Early Steps Pediatrics, we are developing and putting in place all of these technologies that I've been talking about. There's essentially 3 stages to Early Steps Pediatrics. The first stage has to do with information gathering. If you recall, at the beginning of this interview, I mentioned, sitting knee to knee with families and giving them the news, with respect to autism and a diagnosis. One of the very first things a family will do at that juncture is begin searching for information. So they're sitting by the lamplight at 2:00 in the morning on Google, searching for information online, or they're crowdsourcing. They're reaching out to families and friends, friends of family members, and they're just trying to gather information. There's a publication that came out just about a month ago, Karen, out of the Journal of Autism and Developmental Disabilities, where they showed that 42% of the information that families are acquiring online through social media is inaccurate. And then there's another 30% that is just overgeneralized. So you get about 70% of the information. It's either inaccurate or an overgeneralization of information. And you can imagine what happens with families that are just searching for information. So you asked about next steps. One of the things that we're doing at Early Steps Pediatrics is using what's referred to as a language model for dialogue application, where we're developing a proprietary system where a family member can enter a question into the proprietary system and get a response that is curated, vetted, and accurate in terms of information. And then once they go through that Q&A session with the system, they have an opportunity to connect with a professional that can review those questions and review those answers with the family. So that's piece 1, is developing the search engine for families and using AI for the purpose of properly guiding them and properly supporting them and making sure that they're not getting inaccurate information. The second part and the second stage of Early Steps Pediatrics is intervention. So one of the things that we're doing is developing a network of speech and language pathologists that once a family is ready to start intervention, they can reach out to their selected person in that network. They will pick the individual from the SLP group who it is that they want guiding them. That speech and language pathologist will teach pivotal skills and pivotal capabilities to the family over a 12-session period, and ensure that the family is then prepared to be primary interventionist and primary support system for their child. The speech and language pathologist is also informed by AI. So that person will use the inputs I mentioned a little while ago in terms of the details of the family, the strengths of the child, the culture of the family, the religious beliefs of the family, to make sure that the output and the guidance is absolutely personalized, absolutely customized. This is, personalized medicine in the area of autism. The third part, Karen, is care navigation. And the care navigation is important because so many families have needs with respect to a co-occurring condition, seizure disorder, feeding disorder, and they need to know who it is in their community that can give them the best guidance. And quite frankly, their own, where they are from a stress level standpoint or from an emotional standpoint, many times becomes a barrier for them to do the appropriate research. And quite frankly, they shouldn't have to be in this place where they're just doing continuous research, trying to figure these things out. Through an AI system, an AI-enabled system that is taking the form of care navigation, they can find out who their local pediatrician is, or who the local, GI doc is that can be the best support to them, or who the local dentist is that has high level sensitivity to individuals on the spectrum and that can provide the best support. So the summary statement would be information, and that being delivered through an AI-enabled system, intervention, that being delivered by a network of speech and language pathologists, and then care navigation, that is a lifelong need for many of these families. Those are the next steps at Early Steps Pediatrics.
I love it. You're on the right track. That's absolutely necessary and beautiful and wonderful. That's great.
Thank you, Karen.
Do you have any other things that you'd like to say to our audience?
I'd just say I think that you have probably over 35 presenters that are on deck for the World Autism Summit. And I think it's so important to really listen to different perspectives, because every individual contributing here is going to bring a perspective, and there's no one person that has all the answers. But by listening to different perspectives, we're able to really cobble together and understand things, in a way that I think is really necessary at this point. So, feather in your cap for what you're doing in terms of organizing this summit. And my recommendation to audience members is really sample all the speakers and get a good sense in terms of how they're thinking and what they have to contribute to your world.
Yeah, we got 56, and then we've got
56,
and then we have the live interviews too. So we'll have 85 total. But yes, there's a lot. Thank you so much for joining us. I love what you had to say, and I'm so glad you could make it onto the call.
Thank you for having me, Karen. Best of luck with this conference.
Great. Thank you so much.